Sudden cardiac death, SCD, is a leading cause of mortality worldwide, striking individuals unexpectedly and often without prior warning. With over 325,000 deaths per year in the U.S. alone, the urgency of understanding risk factors and prevention strategies is paramount. Despite medical advancements, survival rates remain low, emphasizing the need for proactive prevention. Scientific research highlights key contributors, including coronary artery disease, arrhythmias, stress, obesity, and nutritional deficiencies, particularly in magnesium and essential heart-supportive nutrients. This episode delves into the latest findings on SCD, risk factors, and scientifically supported interventions that may reduce risk and enhance cardiac resilience. Can sudden cardiac death be prevented? The unexpected nature of sudden cardiac death, SCD, captures public attention, particularly when it claims the lives of young athletes, celebrities, or otherwise seemingly healthy individuals. Yet, SCD is not as unpredictable as it may seem. Scientific research provides clear insights into risk factors and potential prevention strategies. Understanding sudden cardiac death. SCD occurs when the heart abruptly stops beating due to an electrical malfunction, leading to loss of consciousness and, if not treated immediately, death. The primary underlying condition in 80 to 90% of cases is coronary artery disease, CAD, where the arteries supplying the heart become narrowed by atherosclerotic plaque. However, SCD is not typically triggered by a heart attack itself, but by arrhythmias, irregular heart rhythms originating from scar tissue formed by previous, often silent, heart attacks. The left ventricle, responsible for pumping oxygenated blood throughout the body, plays a central role. When arrhythmias originate from this chamber, they can rapidly spiral into fatal ventricular fibrillation, a condition that renders the heart incapable of delivering blood to the brain and other organs. Who is at risk? Several key risk factors increase the likelihood of experiencing SCD, including previous heart attack, especially within 6 months when scar tissue is most likely to trigger arrhythmias. Enlarged heart, cardiomyopathy, often associated with heart failure or chronic hypertension. Diabetes, poorly controlled blood sugar levels increase inflammation and oxidative stress in the heart. Family history of SCD or arrhythmias, genetic predisposition plays a role. Obesity and metabolic syndrome, visceral fat, secretes pro-inflammatory cytokines, contributing to heart disease. Magnesium deficiency. Magnesium is crucial for heart rhythm stability, and deficiencies are common due to dietary patterns and stress. Smoking and drug use, particularly stimulants like cocaine and methamphetamines, which significantly increase the risk of fatal arrhythmias. High stress and inflammation. Chronic stress raises cortisol levels, which can impact heart function and contribute to cardiovascular disease. Why survival rates are so low? Survival after SCD is critically dependent on immediate response CPR and defibrillation. If delivered within the first few minutes, survival chances increase significantly. Automated external defibrillators, AEDs. Found in many public places, these devices can restore normal heart rhythm if used quickly. Emergency response time. Many cases of SCD occur when the individual is alone, reducing the likelihood of immediate life-saving intervention. The role of nutrition in prevention. Beyond traditional risk factors, recent research underscores the role of nutrition in cardiac health and arrhythmia prevention. Some key interventions include 1. Magnesium and potassium. Both minerals are essential for maintaining normal heart rhythm. Magnesium deficiency is associated with increased heart muscle irritability and higher risk of ventricular arrhythmias. Studies suggest that supplementing with magnesium may reduce the likelihood of SCD, particularly in individuals with diabetes or cardiovascular disease. Second, omega-3 fatty acids. Studies have demonstrated that omega-3 fatty acids, particularly DHA, help stabilize heart rhythms and reduce inflammation. A diet rich in fatty fish, flax seeds, and walnuts may provide cardioprotective effects. 3. Coenzyme Q10, CoQ10, and L-carnitine. These compounds support mitochondrial energy production in heart cells, reducing oxidative stress and improving cardiac function. CoQ10 deficiency, often exacerbated by statin drugs, has been linked to increased heart failure risk. 4. Reducing omega-6 fatty acids and processed foods. Diets high in processed foods and vegetable oils, such as soybean, corn, and sunflower oil, increase systemic inflammation and contribute to arterial damage. Opting for extra virgin olive oil and coconut oil instead may help balance inflammatory responses. 5. Antioxidants and flavonoids. Polyphenols found in berries, dark chocolate, green tea, and vegetables support cardiovascular function by reducing oxidative damage to blood vessels. Lifestyle modifications for heart resilience. Regular physical activity, exercise strengthens the heart, improves circulation, and reduces inflammation. Stress management. Chronic stress exacerbates heart disease. Mindfulness, meditation, and heart math techniques can regulate autonomic nervous system function. Quality sleep. Poor sleep increases cardiovascular risk factors such as hypertension and diabetes. Avoiding stimulants. Limiting caffeine and alcohol intake can help stabilize heart rhythms. Conclusion. While sudden cardiac death is a formidable challenge, it is not entirely unpredictable or unpreventable. Through lifestyle interventions, dietary adjustments, and increased awareness of early warning signs, the risk of SCD can be significantly reduced. Prevention starts with education and proactive health management. What we choose today impacts the heart's ability to function optimally for years to come. Disclaimer: this episode is for informational purposes only and does not constitute medical advice. If you have concerns about your heart health, please consult a qualified healthcare professional. Lifestyle changes, dietary modifications, and supplements should be discussed with your physician before making adjustments.